Hi everyone, Dr. Ann Clark here, physical therapist. I wanted to talk to you a little bit about hip pain versus the back pain. So I'm waiting for my patient and I have a minute and I want to talk about it because it came up in my last visit with my other patient. So oftentimes people will say, well, I don't know whether it's my back or my hip. And although oftentimes they're pointing back here. So if your pain is more in the buttock, top of the pelvis, then that's usually more of a back issue. But oftentimes people think, oh, it's a hip, so is my hip hurts. Oftentimes that pain is radiating from some sort of disc issue or stenosis or some sort of impingement on a nerve that happens in the low back. If your pain is more in the front, right in here, like in the groin area, then that oftentimes is indicative to like an arthritic hip or a degenerative hip or a hip problem, maybe a labrum, maybe sports hernia type of thing. And that's usually younger, but obviously the degenerative hip is more in the older population. But that's usually the groin pain right in the front. And that's usually not back. That's typical. Of course, anything can happen. The back can affect the entire leg. But typically, pain back in here, upper back, buttock, is typically related to the low back, and then the groin is typically related to the hip joint itself. Then you have people that complain about the pain on the side of their leg, right? That can also be back related, but oftentimes it can be very, like if you can actually pinpoint that, palpate that little area that's really sore, and then that whole iliotibial band, then that's a little more of a local problem. Very common is that hip bursitis that people will get. So you get the bursa sac that's right on the bone on the side of your hip. You can press it; it hurts. When you lie down on that side at night, it'll hurt. That's often a bursitis, and that's kind of local to the area, not necessarily the back. However, you can have side leg pain with the back as well. But typically, it's pinpoint pain and that soreness in that one spot. Sometimes it radiates down your iliotibial band, which is that long, thin, strappy muscle. That's just more of a local problem. So I hope that information will help you kind of figure things out. If not, give me a call and we can talk about it more. Take care.